Hi everyone, it's Debbie Jordan and I'm here to talk to you today about my presentation, Reducing Barriers and Increasing Resources for the Homeless Population in the Greater Portland Community. Today my objective is to increase the knowledge for staff about shelters, access and barriers to shelters, provide knowledge about community case management and how to access, identify medication barriers and tools to access in the community, identify geographical barriers and options, and introduce a trifold that a classmate and I developed in another class, how to access and just what this trifold holds to help you and your patients. Portland area has several local shelters. Some are for men, some for men and women only. Some are for families, and some are for our youth that are homeless in the community. I think recognizing that there are several different types, different times that folks can come to each of these shelters, and just exactly what the sleeping arrangements are at these shelters. Just opening up the awareness that this is, in most cases, a 2-inch mat on the floor, helping people think about the condition of your patient when you're sending them to the shelter. Are they physically able to get up and off the floor? We have a growing number of medically complex folks in the community that are homeless, using walkers, using canes. That can be a true limitation, and I just want to increase the awareness of this sleeping arrangement. You know, I thought this man's picture was just so speaking that no one would choose to sleep like that. And when you physically see the picture of mats on the floor, it sort of opens up the awareness of exactly what that must be like to sleep on the floor and help us think a little bit more about the physical challenges and limitations to that. A number of these shelters do have medical beds. These medical beds are easier to obtain if folks have been in the emergency room. They do have limitations. They have a doctor's note, a prescription from the emergency room that will help um, get them a priority to one of those medical beds if there's one available. But agreed that they are very limited. Medication access and the homeless is a huge issue. They come to the emergency room and they need acute care. They need treatment for their diabetes, which is unmanaged. They need COPD meds um, or acute antibiotics, cardiac meds. Maine Medical Center's outpatient pharmacy has just gone 24/7. This has been a huge access availability for us with this population. There are critical meds dispensed at this pharmacy, as well as antibiotics for low income and being able to treat acute conditions. The other benefit to this is I can have these medications delivered right to the patient's room in the emergency room. I think remembering to decrease the risk that the person being prescribed isn't going to take the medicines. We can say that it's not hard to go upstairs and get the medication. However, for someone who maybe lacks follow through, going upstairs, standing in line for 25 minutes may be beyond what someone's going to follow through and do. I'm not saying that we enable, I'm saying that we do our very best to make sure that folks get their medication. The geographical barrier in getting medications can sometimes be a real issue. Um, there is a waiver program with general assistance in the greater Portland area. The folks in our emergency room have to take the prescription, walk 1.8 miles to general assistance. They have to stand in line lots of times, a good portion of the day to do this. So if it's 4 o'clock in the afternoon, this waiver is not going to get done, and then they're not going to be able to walk another 3 blocks to fill their medication. Really thinking about the plan that we're putting in place to get medicines and if it's possible. Again, thinking about if you have a person with COPD, getting a waiver and walking 1.8 miles probably isn't going to happen if somebody's really having a hard time to breathe. That may need a taxi pass to go get their medications. So really thinking it through, Maine Health does have a med access program in the community. If we can hook our patients up with care managers, they can help them get to this med access program, which is right over by the shelter, and get them enrolled in programs where they could get their medications for free. I think just being aware that these are access options and help us make sure that this very needy population gets the medications that they need. It is not uncommon for me to see um, folks every week coming in with hyperglycemia, sometimes DKA, not taking their medications. There is medication storage at the Greater Portland Community Health Center if the person is a patient within their practice. Encouraging that is huge. It's right across the street from the resource center, and it's just around the corner from the Oxford Street shelter. However, if you have a patient that's at a shelter like Florence Street across town, then that may not be the best option. So, really, working with care management is critical in putting some of these discharge plans together, which leads into the importance of community case management and how to access the Preble Street Resource Center, which you'll see in that picture. I've shown you a picture of the courtyard. They have a number of resources, and community case management is one of them. Patients can go into the resource center and sign up on a sign up sheet. I used to think that this was really easy until I went out to the resource center. They take 2 a day. So if you don't sign up by 8 o'clock in the morning to see a case manager, you're probably not going to get a new intake that day. However, if you're established with a case manager at Preble Street, you probably can connect with them because they come in and out of this courtyard area all day, and their offices are right up in that building, so they can access them. The other great thing that's come into the streets of Portland is the Maine Health Homeless Health Partners. This is a group of social workers that started as a grant, and being able to hook up our homeless folks that are complex medically with one of these social workers has been a huge benefit to the community. So knowing that we have these folks, we call them angels in the community, and setting our patients up, they help patients access medications, they help them access housing, they help make sure that they have community transportation to get to and from important doctor's appointments. They work with them on just about any issue that's helping or any issue that is complicating the life of this homeless person. Understanding that Portland has geographical barriers um, is really important. And I can tell you myself, I've been ignorant to this understanding in my own practice, spending time on the streets and learning, this is a man in a wheelchair in a snowstorm. Is that not a common issue in Portland? It is common. The elderly, the folks that I work with in the emergency room that are using DMEs, whether it's walkers, whether it's wheelchairs, whether it's crutches, cane, and the chronic nature of some of the folks that we're dealing with that are homeless, that are just chronically ill folks that are now living on the street. And the geriatric population that's homeless is just growing, and seeing this in the emergency room is heartbreaking. So it's not a judgment call. We need to remember that if someone needs a cab pass to get from here to there, we need to provide that. We're here to take care of our community, not give things for free, but we need to make sure that our person that we're working with can actually physically get there. It's 1.8 miles from our emergency room to the resource center, just about 2 miles to get to the Oxford Street shelter. And I just ask that and make you aware that that is a barrier. Where is the PCP office, and does it make sense? The Florence Street is down around the block from Maine Medical Center. A Maine Med practice on Congress Street may make a lot of sense. However, if you're living at the Oxford Street shelter and spend most of your days at the Resource Center, 1.8 miles away, the Greater Portland Community Health Center directly across the street from the Resource Center may be the best option for you. Um, that also has social work, it has med administration, they have a nurse practitioner, and they do wound care. So, really thinking about the geographical barrier and increasing access for those patients. Um, and again, I think I've talked about the distance from Maine Med ED to the Preble Street Resource Center, which is the open day center for most of these folks, is 1.8 miles away. So, really, just making yourself more aware of those things, I think, is really important. So, a classmate of mine, Dan Svensson, and I, in a previous class this summer, put together a trifold in hopes that it would meet the basic survival needs with information for a homeless person entering the greater Portland community. We keep these in our emergency department at Maine Med. The Department of Care Management has them. The Preble Street Resource Center has them, and our Maine Health Homeless Partners have them. The goal was to have a one-page piece of paper that would offer resources with times in and out of shelters. You'll see here, this is the trifold that we put together. It lists the shelters, the times that you can come, the times you can go, food, transportation, medication, where to seek health care, and critical hotline information. I can't stress enough the importance of reducing barriers and increasing these resources to this population that has a difficult time at baseline. When I talked to staff and I did these presentations, their reaction was much like mine was when I went into the community to learn more. I didn't know more. I didn't know about the Greater Portland Community Health Center. I didn't know that it was 1.8 miles. I didn't even know from our own clinicians in the emergency room that we could get those meds filled at the pharmacy, and the barrier that going to general assistance to get a waiver really placed for this population that we're working with. Most of it was exactly as I said. I didn't know, I didn't know, I didn't know. So I felt very hopeful that as we increase our own knowledge, we'll put together plans that are going to be doable, which is really why we're here. If we put together a discharge plan that isn't doable, then we're not helping this population. I was thinking about how, as an emergency room, we can work at tracking. Has this information impacted our discharges and helped folks not end up back in the emergency room? We do run reports about frequent flyers in our emergency room, um, high utilizers of the system, and try to outreach to those folks that seem to be coming over and over, whether it be multiple hyperglycemic events, whether it be multiple visits to the ED where their needs could be being met at a community provider. Those folks we try to refer to care management, we try to work together to put plans together. So the folks that we're working with, we can track and we can see if it has decreased their ER utilization. I also think that we'll see a difference in the frustration of our team in the emergency room by knowing that there are resources. And that was, what, again, to what I heard from the staff as I gave these presentations is we're frustrated because we just don't know how to help. And it becomes daunting when the emergency room is full and there are patients in the hallway. So hopefully, this will help increase um, awareness to our staff, decrease frustration with a population that often feels being judged anyway. And so we'll see that in our reports that we run about high utilization in the emergency room. We also have a great relationship with our homeless health partners. So being able to track, I made this referral to you and follow up. How is that patient doing? Did he get his antibiotics? Is his outpatient visit going okay? And really do that full walkthrough with, I made a referral to you last week, how's it going? And if there's any new information, we have an FYI tab in our documentation system at Maine Med, and being able to put that in there so that we could make a more um, appropriate discharge plan if there are already community resources in place. Um, this has been a really rewarding um, area of interest of mine as I work as a case manager in the community. More rewarding is being able to share the information I've learned with others to be able to impact. When I did this presentation to a group of physicians and residents, the first thing they said was, I just didn't know. And the second thing they said was, how do we have this trifold available to us all the time? My referrals to help work with this population in the emergency room after giving these presentations to all groups has increased. So it's been a win-win. I'm going to give a couple of examples of areas that medication access, um, breaking down barriers for transportation, and working with community case management has impacted. I had the honor of working with a woman that was 48 years old in the community with stage 4 pancreatic cancer. She didn't take the amount of medication she needed because she was afraid living at the shelter that somebody would steal it. We were able to help her with medication access and storage. We were able to, the community case manager met with the leadership in the shelter she was staying in. It was able to be set up that she could keep her things in a locked box. She also wanted to maintain her privacy and her dignity. I was absolutely blown away about a homeless woman with stage 4 pancreatic cancer living in the community and how many resources she didn't have, how this community case manager helped set up her transportation to the cancer center to be able to get her chemotherapy treatments. It was an eye opening case and one that certainly made me think further about how I could help this population when they come to the emergency room. The other case was a man who was at risk at losing his leg. He'd had osteomyelitis several times and lost several toes. He actually, at the time he was in the hospital, was connected with one of our homeless health partner social workers. He was homeless. He had no disability. He had no money. He had no main care. Um, and he had multiple wounds on his foot. A wonderful gentleman in his late 50s. His 9-month relationship with this community case manager certainly opened my eyes to why we need to remember the importance of this service in the community. She helped him apply for main care. She helped him apply for disability. She helped him get into permanent housing at the YMCA. She helped him get to the bariatric center at the Brighton campus in Portland, set up community transportation, and 9 months later, this man is now in an orthotic shoe, living in his own apartment, having true quality of life. And when looking in his record, he hasn't had any emergency room visits. He goes to the Greater Portland Community Health Center. They do a sock exchange with him every day. And at the time that that's done, if they see anything else urgently going on, they'll set up for him to go to the wound center to get this checked out and make sure that things aren't getting worse. His community case manager goes to all of these appointments with him to help really work with he and the providers to see if there's any other resources that can put into place. This was amazing to me. This is a resource that we need to be certain if our patients need it, they get it. I hope this has been educational for you. I hope that you can see how sharing this information has certainly impacted the staff and helped change some of the access and reduce barriers for our homeless population in the emergency room. Thank you.